Dr. Rupa Wong here. Today's episode is going to be about Botox and the possibilities of eye complications from it. Should you be using it around the eyes? Let's find out. Welcome back to my channel. I'm Dr. Rupa Wong, ophthalmologist and managing partner of Honolulu Eye Clinic. And you might be wondering, why is an ophthalmologist talking about Botox? Isn't that for dermatologists and plastic surgeons? Actually, no. So, you know who first invented or why Botox was created in the first place? By an ophthalmologist for specifically strabismus. Now, strabismus is exactly what I do. It's my subspecialty in ophthalmology. So ophthalmology is eye surgery. Strabismus is misaligned eyes, like lazy eyes, and I do surgery for lazy eyes. So Botox got FDA approval in 1979 for strabismus. So I started using it when I was in training because we can inject it directly into the eye muscles to help realign the eyes. That's pretty cool, right? And then they've discovered it had that side benefit that it cleared all your wrinkles away, which is why I love it. So anyway, that's a little backstory. Given that, I inject a lot of Botox, especially for medical purposes and for another reason, which is called blepharospasm. That's that annoying twitch of your eye. We can talk about that in another video. But I get very close to the eye structure since I'm an eye surgeon, and a lot of dermatologists are not as comfortable injecting around that area. So is Botox safe around the eye? And the short answer is yes, it can be very safe around the eyes in the proper hands. You want someone that's going to be knowledgeable about the eye anatomy and what structures to avoid to prevent some of the complications that we're going to be talking about. So I haven't had Botox in about 7 months. So you can see, you can see my wrinkles. That's called the frontalis muscle right here. In here is the glabella that gives you the 11s or the triple ones that everyone's talking about. Around here is the orbicularis muscle. The orbicularis muscle is a sphincter. So I'm showing you these areas because this is what's commonly injected around the eye, and this is what can lead to complications. So a lot of times when we're injecting the glabella, the most common pattern is to use a 5-point injection. And I'm going to be marking myself up and injecting myself a little bit later today, so I will show you that too. But typically what is involved is a 5-point injection, and the part that is very close to the middle aspect of the eyelid is where you can get lid droop or ptosis, starting with a P, silent P, ptosis, and that's a possible complication of Botox. It's kind of the most feared complications when people come in and they look like that because the Botox has penetrated past what's called the orbital septum and has caused the eyelid muscle to droop. So that can happen in anywhere from, in some studies, it's shown to be about 1% to 2% complication rate. And some studies showed even like up to a 50%. But the average in an analysis was about 13% of injections in this area can cause lid droop. So ways to avoid it is to not inject too deeply when you're going out laterally in this particular area. I will keep my higher dosing right there in these 3. And then when I do these 2 lateral injections, I'm making sure I'm not going too deep. I'm also not injecting as much because I really don't want to give a patient lid droop. It's awful. But the good news is it's transient, meaning it's going to go away after about 3 to 4 months. And there's some things that we can do, eye drops, to be able to elevate the eyelid so we can get people through it so they don't look terrible after they've had this complication from Botox. And it's not necessarily a reflection of the skill of the injector because honestly, sometimes it just happens. So that is one of the complications is eyelid droop from Botox being injected for your 11s. One of the other complications is double vision. So I mentioned earlier that Botox was first developed for strabismus or misaligned eyes, and that's typically causes people to have double vision. What can happen is if you are injecting underneath the eye, which I will do for my patients, they really like that softening, like I have it. It's the worst area personally for me. You can see that little jelly roll. I like to get injected right there. I will inject myself right there. I inject my spasm patients right there. If the Botox goes and diffuses in, it can affect what's one of the muscles of the eye called the inferior oblique muscle, and it can cause the eye to drop down a little bit and give you double vision. I have also seen it when it's being injected for the laugh lines or crow's feet and infiltrating into the lateral rectus muscle, the muscle that moves the eye out, and causing double vision and the eye to cross in that way. That is very, very rare, but it's a possibility. So you do want to be mindful of that when you're going in. It's possible to get double vision or a misaligned eye from having Botox injected around the eye. Again, you want to keep those injections pretty superficial, which is what I do, and not use too much in those areas. Another common area around the eye to inject, other than right here in the glabella or right underneath, is over here, those laugh lines, right? I don't know, why do men look good with laugh lines and women just feel the need to erase them? I'm not sure. I personally don't like to deaden those because I think it makes the eyes not look natural. So I like a little bit of laugh lines. You want to look a little natural, but you obviously don't want to have like all of those wrinkles. So this muscle is called the orbicularis oculi muscle. It's a sphincter, so it's a round muscle, and you can inject all around it to get rid of those laugh lines. The problem occurs is when you are injecting, you can also cause some complications. You can cause the bottom eyelid to flip out, which is called ectropion. So that's a possible complication from injecting around the laugh lines. And in general, because it's a sphincter muscle closes in, you're deadening it, right? That's what Botox does, is it makes the muscle not work quite as effectively. And you need that muscle to blink. That is what helps your eyelids blink. It's what pumps the tears out of the tear gland. So if you're deadening that muscle too much and you don't have a good blink reflex, that can also be called lag ophthalmos, and it can cause a lot of dry eyes too. So you can get dry eyes and exposure from too heavy of a hand with Botox. So you do want to be mindful. And again, that's why I always err on the side of being really cautious when I'm injecting somebody. You can always go back in later and put more Botox in. I would much rather have them come back in than over-inject someone and cause some of these other complications like the lid flipping out, a lid droop, or dry eyes. I mean, you need to be able to close your eyes to sleep at night to prevent your corneas from drying out. So it's a really bad situation if your eyelid closure is not forceful and it's not tight enough to protect the underlying surface of your eyes. And then other types of side effects that you can get: bruising, hemorrhaging, can get headaches. Some people will get headaches when they're being injected, especially if it's along the forehead area. Those are all very minor type of complications. And again, because Botox is not permanent, it wears off after 3 to 4 months. All of these complications, for the most part, are not going to be permanent as well. So they're going to wear off. You just kind of have to just grin and bear it. And there's some temporizing measures that we can use to get yourself over the hump. So that is about it. I hope that was helpful for you guys. If you have any questions about Botox, I'm going to be injecting myself very soon. I'll show you a little after. So here, before. And then let's wait and you can see my after in a little bit. But if you have any questions, you have any comments, you have thoughts about other types of eye surgeries, please drop them below. I read everything. I'm happy to try to produce videos that you guys are interested in, and just keep those questions coming. So I hope that was helpful, you guys. Thanks so much for watching. Please like this video, comment below, subscribe to the channel. It helps keep this channel going as I do it after hours, and I would love to be able to keep producing content for you all. So if you have any questions about ophthalmology, specific eye surgeries, please let me know. I read everything and I would love to hear from you. Mahalo for watching.